Hello, TOVA community. I'm Dr. Nina back for another episode of TOVA Tuesday, where we talk to leading members in our healthcare community, healthcare professionals who serve our community to help us improve our overall health and wellness and help us live a healthier life. I am so excited today because we have on our show Dr. Carter. And Dr. Carter is an amazing woman because she has dedicated her career to advocate for children with intellectual disabilities like autism. And we really need people out there to work with those who need more help and resources so they can live up to their fullest potential as well. So I'd like to welcome to TOVA Tuesday, Dr. Amanda Carter. How are you today?
Am well, and yourself?
Thank you so much for coming on the show. You have such an impressive resume, but I wanted to know there's always something uniquely inherent in an individual that seeks them to want to work in a specific area. And I am just interested in how did you become an advocate for children with disabilities?
That's a great question. So while I was in college, I'd worked with a child who had a diagnosis of autism. He had a younger sister who was neurotypical. She didn't have autism, and just kind of seeing some of the complexities that, he encountered in the maladaptive behaviors that he struggled with was truly inspirational for me. I always wanted to figure out ways where I can be of great service to the family. He had a history of elopement, so he would always run. So I would always have to be prepared to pull out my track shoes and ensure that, he was safe. And then while I was working on my master's, I attended Howard, and I stumbled upon another family, and mom has 2 children on the spectrum. And to this day, mom and we still maintain a very cohesive relationship with one another. And since then, I've advocated a lot, especially on the international level, supporting individuals on the spectrum. And I just believe that I am one of the voices for clients who cannot advocate, who cannot speak up for themselves. They are at such high risk for potential exploitation out in the community. So we need good people, good providers who will ensure that, our individuals are taken good care of.
Yes, that is so important. And also the fact that you have such an impressive background, and it seems like through all of your educational training, you've always worked with children who have unique intellectual developmental disabilities, even going to as receiving your PhD at Nova Southeastern University. Can you talk about that?
I'm sorry. So as it relates to NOVA, I started off at Shaw University. I majored in psychology. And at one point I thought I wanted to go to medical school or go to law school. And being that I worked in behavioral health while in college, it really kind of piqued my interest. So that led to me going to Howard to get my master's, as well as NOVA to obtain my doctorate. So I was in school for 10 consecutive years, and I apologize about the phone.
No problem. As an entrepreneur and a small business owner, you have to multitask. So I completely get that. One of the things that I found was very interesting about you and sort of how you've developed your programs around helping children with autism, but also other intellectual disabilities, is that you have a love for horses and a love for dogs. And I love your dog, Bailey. Can you talk about those 2 parts of your family as well?
Sure. So I've always loved horses. As a child, my dad would take me to like the horse shows, and I would always like to see them just race.
Uh-huh.
And that was just always exciting to me. And I'm like, oh, I want to become a jockey, but I wasn't, small enough to become a jockey. So kind of, experiencing those moments, it really kind of piqued my interest. And then I said, you know what, this would be a perfect way to kind of cultivate what I'm very passionate about, equine therapy, as well as, integrating them with some of our clientele. So that's kind of how the horse, therapy program kind of came into light with our organization. And then as it relates to the dog, I was what you call a puppy raiser. So I raised a service dog for a family. It was a very difficult transition giving that dog up. And I'm just like, oh no, the dog had become a part of my family. So, I said, I want to get another dog. So after that, I ended up getting Bailey. And Bailey definitely made me forget all about Leo. Bailey is a sweet dog, but he is very high maintenance. And Bailey has been on a very long sabbatical, but he has been featured on TV, and, he's done a lot of different things in the community to support children on the spectrum. This has been some years ago. He did prevent one of our participants from elopement. So the child, he ran like in a big construction site area, and we let Bailey loose, and Bailey came back and he, brought the child to safety. So
Wow.
He was a true hero in that situation. So, yeah.
And I'm sure he's a Labrador, may I ask, retriever?
He's an English golden retriever.
Oh, okay. So they have a softer personality. Are they easy to train? Like I'm sure that was a challenge as well, because, children may want to grab them or, hug on them, and he has to, really know how to step away, but, be gentle with them as well. I would be worried if it was my dog who had to. I don't think he would pass that test, but that's you really have to do a lot of training to get your dog or a service dog, to be able to serve children, especially those with unique needs.
Absolutely. That is absolutely true. And I was a puppy raiser for a service dog. Bailey is considered more of a therapy dog, but if we were to go out in like a public establishment, I usually call and let them know that, we have a therapy dog, coming, and they're usually fine with that. With the service dog, you don't have to receive all of those prior confirmations, just because of, ADA's laws and regulations.
Oh, thank you for sharing that. I didn't know it was that intense, but I'm sure you have to be, because of, for liability reasons. But just transitioning back, I wanted you to kind of explain what is the autism spectrum, because we hear so many different things. You may have, those who are highly intelligent but learn very uniquely, and then some people who have autism spectrum disorder that have more intellectual disabilities. It seems like there's a huge range of where a person can fall on that spectrum. Can you talk about that and where we are today with?
Sure. So autism spectrum disorder is a developmental disability that impacts one's social skills, communication skills, interpersonal skills. Some signs and symptoms that you may, find when, someone is diagnosed with autism may include echolalia, where they may repeat words or phrases. They may have restricted interest, lack of interest in activities, limited ability to engage in parallel play. There may be some lack of motor coordination, lack of ability to do everyday daily living skills type of activities, sensitivities towards certain textures, sounds, smells, limited attachment, issues. They may not want to be around, large crowds or certain individuals. And family, and it can vary more on the higher functioning end of the spectrum. They may lack the ability to maintain employment, for example, or maintain and keep sustainable relationships. So they may struggle, in those areas. They can be very brilliant, because I know some very brilliant people, with autism, but that peer interaction is a true struggle. And, you know, as we all know, individuals, especially those who are more severe, they may lack a lot of awareness. We have a lot of clients who are on the severe end of the spectrum. So they may have a history of elopement, potential exploitation. So, you know, they would give all of their money to, you know, a cashier and not have any discernment. So that's where they need that additional support, someone who will help advocate them to ensure that they are not being taken advantage of.
Wow, thank you so much for that. It does seem that there's definitely different levels or different, each child can have very unique needs and how they interact with others, and also how sensory stimulation seems to affect them or promote anxiety if you stimulate them too much, or if you push them in a way that they can't seem to comprehend or understand, that can be a frustration to your client, and also to the family member or the person that's caring for him. So you really need to have specialized training to work with children or adults with autism, would you say?
Absolutely. I mean, this is not for the faint of heart. Everyone cannot do this. I feel like people who are in this field, they have a true gift, because you have to have a different level of patience. We have clients who are extreme spitters, so they will spit on you intentionally. And, you know, the average person doesn't like to be spat on, which I completely understand. But, you know, sometimes we have clients who have issues with oral stimulation and they cannot control that. So, you know, you have to be prepared for situations like that. Or you may have clients who are very aggressive and they may hit, they may kick, they may punch. I mean, we see a lot of different behaviors. And they have this roaming. For example, at our TI facility, one of the kids, she was off, she was having a bad day. So you have to kind of be prepared for, you know.
Thank you so much. Our internet is breaking up a little bit, so we'll try to make sure that we can get the conversation as best as we can. But thank you so much for that, Dr. Carter. I just wanted to recap what she was saying, is that, you know, children can, you know, have, you know, behavioral issues. They could spit, they could, you know, hit. And so it takes not the faint of heart, people who are very dedicated and are trained to understand how to work with this group of people who really need a lot of support and a lot of resources. So I'm just recapping what you were saying. So I wanted you to talk about CARIFAT and your organization and the services that you provide for those in the community with autism and other intellectual disabilities.
Sure. So CARIFAT stands for Care and Recreational Activities for Autistic People. The agency was established October 30th, 2014. We provide services in over 13 jurisdictions in the state of Maryland. We are an approved autism waiver agency and DDA provider in the state of Maryland. We work with many families to date. And the average DSP, we call them DSP, also known as Direct Support Professional, they have at least 1 year of experience working with those with intellectual and developmental disabilities. Some of our DSPs to ensure service delivery is done effectively and efficiently. Some of our services under our autism waiver program include IISS, which stands for Intensive Individual Support Services. And the purpose of that service is to ensure that our DSPs are actually working on goals that may be illuminated in one's treatment plan. So if, you know, a child is making efforts in the areas of hygiene and grooming, or communication. We'll be working on goals to help that child to develop that level of autonomy. We also provide a service called respite, and respite is designed where we are providing relief services to help support our families. Another service we provide is adult life planning. So that program really kind of helps families as they transition off of the autism waiver program to learn more about our DDA services. A lot of times when kids age out, entitlement services are lost if there isn't proper planning and the proper transition. And families can feel, very lost, exhausted, and overwhelmed of the next steps that need to be taken in order for their child to have a successful future as much as possible. Another service is called family consultation. That service is designed where, we have at least a master's level expert or one who have that may have a PhD, where they go in and they provide expertise as it relates to, autism. Sometimes we deal with families who think they know everything and they have it all under control. They don't need any help. They don't need any additional guidance and consultation. So sometimes we have to work with those families, work with families who are in denial too. Denial meaning that, they think that their children would, be able to work a job, and the child may be extremely severe, and, their ability to, work in a competitive setting may be very difficult, for that individual. So we also provide services like that. So that's a little bit about our services. We also provide very innovative services. So we have a program called Zam Dance. Zam Dance is kind of designed like how Zumba is. And yeah, it's a very fun program. Zam Dance is actually going to be here tomorrow and at our field day on Saturday. So it's an activity where, kids can dance and get good exercise. And for our field day on Saturday, we decided to, create something because we've been in COVID for so long, and now people are all out and enjoying themselves. So our field day will have Zam Dance, we'll have a wet water slide, yoga, relay race, sack race. I mean, we will really be able to be kids again. So we're really super excited about, our upcoming field day. We also integrate horses, as we discussed earlier. So we're always looking for various things to kind of like really highlight individuals with disabilities, because we too believe that despite whether one has a disability or not, they should be able to do the same activities that neurotypical people, are able to engage in. And the last comment that I will say, in 2019, we had a fashion show highlighting our clients. As you can see in the picture, we have service dogs. So the service dogs were also in the fashion show walking down with our clients. It was a
nice
experience. And we're hoping, we'll see where we are as we get closer to December. We're hoping that we can, resume that. But we had a blast when we did that in 2019.
Dr. Carr, I wish I had you as a teacher growing up. Wow. You're really innovative, and you've provided a lot of creative programs and services to meet the needs of our clients. That's to be commended. I also wanted to share with our community, we talked about some tips. Me as a primary care specialty provider, and I take care of people with sickle cell anemia, and some of them have cognitive disabilities or intellectual disabilities as well, even. And so they learn uniquely. But I also wanted just to share a couple TOVA tips for parents who may think that they have a child who has a learning disability, how to seek help. And then I wanted you to comment on what makes your programs, your services unique, and how impactful you feel and the parents feel that they are, and how we can support your programs moving forward. So the best thing to do is to start with a visit to the primary care provider to make sure that they have a wellness evaluation. And sometimes the primary care provider may say, we want you to see a neuropsychologist or a developmental pediatrician so that they can do a full developmental exam and also screenings and tests to actually find out what the problem is, what the diagnosis is. The school guidance counselor can also be a resource, working with teachers, making sure your child are in appropriate classes where they can reach their fullest potential. It's also important for parents to build a support team around them, because taking care of a child and with intellectual disability is very challenging. And sometimes you need time for respite, but also to talk to other parents to find out any tips or other resources that can help you. You must be patient, as Dr. Carter said. You have to be able to work with each child uniquely, be very creative, as Dr. Carter was saying, and you need to figure out ways to engage your child, which may have different style of learning than your other children. And most important, you have to take care of yourself, practice self-care. So you need time to yourself. Make sure you take those breaks, practice yoga, get out, take a walk. Just take 15 minutes to yourself once a day just to be mindful. Dr. Carter, do you have any other tips that you would share?
I think the biggest thing, and I think one thing that has really helped us become very successful with this, is because we are unorthodox thinkers. We think outside of the box. We're always trying to find ways to be creative and do things that people have not already done. And the field day kind of came up in a dream. So it's just like, wow, that would be amazing. Like, we should do this. Like, this would be a really good opportunity to just have fun, have a good time, and be outside and enjoying the weather, since we were unable to do that for the past year. So that would be my advice to any type of person who has like a behavioral health agency, or may even be working for a behavioral health agency. Really trying to identify what your clients' needs are, and embracing those different things. So here at our TI facility, we have a lot of different things. We're always like on Amazon trying to find different things to kind of help engage our clientele. So we have like a trampoline, and the kids really love that type of stimulation. And it was a great investment to really kind of support them. So that would be my biggest advice, to really meet your clients where they are and provide whatever accommodations needed so they can have a fruitful, successful, and productive life, because that's what we're all about.
Thank you so much for that. Because we could be talking for hours and hours. It's just been such an enlightening show today. I want to ask you, what do you think, as far as your program CareFat, what has been the most impactful service, or what have you seen in a child that has given you that push to continue to do what you do, that says, wow, I've really made a difference in at least one child's life?
Yeah, so great question. But before I answer that, I've had parents to come to me and personally say, because of your organization, I did give up. So like hearing stuff like that brings tears to my eyes. It's just like, wow, like sometimes, you know, because it's very fast paced and you're dealing with a lot of different behaviors, things move quickly. And to hear somebody just to say, I just appreciate, you know, what you've done, sometimes is the only thing that we need. You know, and then we also provide services to one individual that I can actually think of. She's been receiving services from our agency for over 4 years. And I remember when she first got on the course, she was very timid. She was scared. She didn't want to do it. And now to actually see her ride a Clydesdale, and
wow,
it's huge. And to see her, how she can maneuver the horse and her posture, and how she can, you know, maneuver the reins and just get on and off of the Clydesdale. It's just a beautiful thing. I mean, I'm just totally flabbergasted to kind of see that progression from a child who did not know how to ride a horse. And we were quite apprehensive too, about her even getting on a horse. And now to kind of see her actually riding a horse alone, has truly, you know, been a beautiful experience and a beautiful story. So that really kind of keeps us going when we see those type of success stories. I can think of another success story where we had an individual who had some turnover. There were some changes in workers, and it was very hard to stat his case because he presented with a lot of aggressive behaviors, and, you know, staff, they were afraid to work with him. But one young lady has been working with him for several months now, and we haven't gotten out one concern, no complaints. And usually after day 2, it's just like, I can't work with this individual. So it's just like, wow, this is really amazing. So we finally found someone that understands his needs and can work with him, and it has gone so well.
Wow, that's fantastic. So before we end the show, Dr. Carter, do you have any last minute comments? I also want to make sure that if you want to reach out to Dr. Carter, learn more about CARIFAP, you can go to www.carifap.com, or you can call her office at 443-542-9177. Dr. Carter, do you have any last comments for us?
No, I just thank you for this opportunity. I enjoyed it. And that's it.
Well, I surely enjoy talking to you as well. And I've learned a lot and really understand and appreciate the work that you do in the community. And surely children's lives have been improved because of that. That makes me just feel so empowered to know that there are people out there that are really providing services for those who learn in a very unique way and need more resources, and that they're fighting to make sure children have the opportunity to reach their fullest potential. I want to thank everyone for joining us today on TOVA Tuesday. You can find out more about TOVA Health TV by liking us on Facebook at TOVA Community Health, or Instagram as well at TOVA Community Health. You can also view this episode on TOVA Health TV on our YouTube channel as well. If you like these episodes, please make sure you donate to our Cash App, which is $TOVA Health, or make a donation to our PayPal account on contact@tovacommunityhealth.org. I want to thank you again, Dr. Amanda Carter, for coming on our show today. You've been just a wealth of information and continue to serve the community and do the great work you're doing. Take care. We'll see you again.
Okay, so I apologize about the phone.